So what are the options for denture wearers with dental implants?
With denture wearers, one of the biggest problems is the bottom dentures. That's typically the ones that most patients will complain about just because of them not fitting very well, or they're always moving around. I think the starting point would be couple implants, the teeth snap into place, they can chew with them comfortably, or at least much more comfortably than they have been. They don't move around anymore. Okay. There is some adjustments needed because the back is still sitting on their tissue. The next option is to do maybe 4 implants. That way, kind of like the legs of a table. So the teeth will snap onto these 4 implants. Now with this, they can basically chew like they have been because now they're fully supported by the teeth, okay, by the implants. I guess the Rolls-Royce treatment of that would be to actually have enough implants down there where you can put a bridge there that stays in place, it doesn't come out anymore, and that gives you...
So a full set of teeth.
Exactly. You got a full set of teeth again, and again, with that, you can function just like your own. You don't have to worry about taking it in and out anymore. On the top teeth, one of the complaints that you get from patients is that the whole palate is covered. Now you can't taste your food, you can't tell if something is hot or cold, so that's a big complaint there. Not to mention, sometimes you just don't get a very good fit with those as well. Again, same thing, you can do 4 implants for teeth that just snap into place. You can do a few more implants and get a fixed bridge in there, and that stays in there for good. And that's going to give you basically a 3rd set of teeth that you
okay, good. How old can you be to do that?
You know, age doesn't seem to be a problem actually with a lot of these patients. And I've had patients in their late 80s and 90s that come in. I had a lady that came in, very little bone on the bottom. It was just like a flat ridge. She'd worn dentures for so many years, this poor thing. So basically, a couple implants, she was like a new person. Implants, as long as the person is relatively healthy and the bone is there, it'll take just fine. And she was a very good testament to that. I mean, after we were able to get just 2 implants in there, totally changed her life.
So no more dentures, no more traditional dentures.
Oh, dentures are just so yesterday. Yeah, absolutely.